Okay, everybody. Thank you all for coming. Good afternoon, and we're going to go ahead and get started. So for anyone who doesn't know me, my name is Shelby Leonard. I'm a public health planner here at the Healthy Capital District Initiative. I work as part of the Population Health Improvement Program, where we support the Capital Region with public health initiatives. I also run what we call the Community Health Liaison Task Force, which is designed for care coordinators, community health workers, anyone who is connecting people to community resources that ultimately support their health. We provide trainings like the one that we have planned for you today, resources such as our Social Determinants of Health Guide, as well as additional resources to go along with our training topics, and networking and fostering community connections, trying to help break down some of those silos within our organizations. We here at HCDI have historically been and will continue to be a driving force in the region for the advancement of the care coordination workforce, including community health workers. So I want to thank you all for taking the time to join us here today as we go through Medicaid and Medicare enrollment and transition processes. Although anyone is welcome to attend, this event is designed with our Community Health Liaison Task Force in mind. Today, we have 3 panelists from our Insurance and Enrollment Services Department here at HCDI. First, we'll hear from Allison Wagner, Director of our Enrollment Services, who will take us through the overview of Medicaid enrollment and eligibility. Then we'll hear from Krista Harbach, Community Health Advocate, who will guide us through the transition process from Medicaid to Medicare via age and via disability. And then we'll hear from Kathleen Clark, another community health advocate, who will take us through the ABD program and applying for Medicaid when Medicare is primary. And then there will be an opportunity for questions after each of these presentations, as well as at the end of the presentation. We have reserved most of our time today to answer questions, since I know that many of you may know some of this information, but a difficult case arises or an issue that you haven't seen before, and that's really where it gets kind of complicated. So we wanted to leave open a significant portion of time for you guys to ask those questions. We also have representatives today from Fidelis, MVP, and CDPHP on the line to answer any questions you may have regarding specific plan coverage, and we'll give them a chance to introduce themselves a little bit later. But from MVP, we have Tenley Klaus, RN Leader of Case Management, and she has a team with her, Michelle Clavicella Chan, Celeste Kay, and Sarah Sabadjo. And from CDPHP, we have Aretha Bevan, Community Health Advocate, on the line. And from Fidelis, we have Jessica Thompson, Community Relations Specialist, as well as Brandy Holmes, the Medicare sales rep for Fidelis. We also have created some reference resources to help guide you through these Medicaid processes that we'll go over at the end, and I'll share this all with you guys in a follow-up email, all of our PDF resources. And lastly, this event is being recorded, and it will be available for viewing on our YouTube page under our new Care Coordinators Community Health Workers Training playlist, and it will also be on our website. So without further ado, I'm going to just open up the presentation here. For some reason, closed on me. Can everybody see that okay?
Yeah.
Okay, great. So I kind of just went through all of this for you guys. I also put our email here at the bottom. If you ever have any questions, you can reach out to HCDI or the VIP email directly. And I want to also invite you guys to our next event next month. We're going to be having an event on obtaining long-term care services and advocacy. It'll be October 28th from 2 to 3:30. I put the registration link here, and if you have any questions ahead of time, please do submit them. It gives our enrollment specialists some time to prepare so we can make sure we get those for you. And lastly, if you want to be added to our care coordination listserv, or if you have a training topic that you would like to request, please feel free to email me at any point and I can try to arrange that for you. So without further ado, I'm going to turn it over to Allie.
Good afternoon, everybody. Hope everyone's staying safe. So I'm just going to give a brief overview of the marketplace. And please, if you have any questions at the end, let me know. This comes as common to me as my name. So sometimes I assume that other people are familiar with terms or language. So just let me know if you have any questions at the end. So the New York State Health Marketplace was created back in 2013. A lot of people will refer to it as Obamacare or the Affordable Care Act. In New York State, it is the hub. That's how I find it easiest to explain that. You can move to the next slide if you want, Shelby, sorry. Is the central hub for health insurance for individuals in New York State. They offer screenings and applications assistance for Medicaid, Child Health Plus, the Essential Plan, and a Quality Health Plan. Today we're focusing mainly on the Medicaid. Typically, there's a certain population that can apply through the marketplace, and then there's a certain population that can apply through the Department of Social Services. And by the end of today's training, hopefully you guys will know the difference of which way to turn your clients. You can go to the next one. There you go. So the individuals that should apply through the marketplace are pregnant women, children, parents and caretakers, or childless adults through the age of 19 and 64 without Medicare. There are, you know, it gets a little tricky around that parents and caretaker relatives thing because typically someone that has Medicaid would not apply, or Medicare, excuse me, would not apply through the New York State Health Marketplace. But if they are a caretaker or a parent of a dependent, then they can, regardless of their Medicare status. Eligibility criteria, typically through the marketplace, it's what they call Magi-Medicaid income guidelines. They're based on the federal poverty level. So they would have to meet the poverty level for their family size and be at or under the income guidelines for that group of people. They must be a resident of New York State or certain qualified non-citizens, such as lawful permanent residencies. There are some visas. There is emergency Medicaid that's available for those that are not citizens. So the best thing that I can tell everyone is to get, try to have us, the navigators, or a CAC, or a broker, or a health plan representative, the marketplace, someone else do that type of screening. When you're trying to decide, do I send someone to the marketplace or do I send someone to the Department of Social Services, it's that first page that we just went over of who can apply through the marketplace. Is that something that you guys should become pros at type thing? If there's any information that you need to learn to steer them in the right direction, it's that population: pregnant women, children, parents and caretakers, and childless adults. The eligibility, the criteria, that, you know, put that burden on someone that does it every day and can, you know, we don't determine applications, we're just help them apply through the marketplace, and the marketplace is the one that makes the determination. You can go ahead, Chubb. Documentation. So prior to COVID, typically anyone that was applying for Medicaid could be asked to provide proof of citizenship, proof of identity, proof of address, proof of income, or proof of insurance. Or actually, I should have added there proof of termination of insurance also. So if you're applying through the marketplace because you're losing insurance, sometimes they would request that letter. Right now during COVID, for Medicaid recipients or people that are applying for Medicaid, COVID has done away with the documentation requirements except for proof of citizenship. That is still being requested, but they're giving people a longer time frame to get that information to them. And then typically that again is on the navigator. So when you, or CAC broker, whoever's helping them apply, will explain what documentation that they need. You know, proof of income example is the last 4 pay stubs. If they're paid weekly, the last 2 biweekly. But again, to keep it simple for yourself, I would just try to learn what population goes through the marketplace. And then what's covered under Magi-Medicaid coverage through Marketplace is your typical services, office visits, labs, prenatal care, substance abuse, mental health, x-rays, labs, cancer screenings, transportation. I'm sure most of you have heard of the MAS system, which is Medicaid transportation. There's dental services, vision, health homes, and family planning benefits. And that's just to list a few of the coverage. Those applying through the marketplace that are looking to get a managed care plan can, without an exception, if they have an exception on their Medicaid case, then they wouldn't get the managed care plan. Or if they're enrolling typically in a health home, there's exclusions and exceptions to every rule. So, but typically someone applying through the marketplace for Medicaid would get a managed care plan. And that's based on which plan. There's 3 different ways that you can apply through the New York State of Health marketplace to get Medicaid. One is through the online. That's at newyorkstateofhealth.ny.gov, and the individual can apply on their own under the Individuals and Family tab. They have to create an account, get a password, you know, that type of thing. There's application assistance through navigators, certified application counselors and brokers. There's a list of them at the New York State of Health website, or they can call the marketplace and ask for a navigator agency or a CAC, broker, health plan, rep, etc. Or they can apply by phone by calling the New York State of Health marketplace. And then Healthy Capital District Initiative also is a navigator program, so they can always call here and get screened, or we can actually do the application process with them. During COVID, we have been granted to be able to do phone applications. Typically, navigators and CACs are in-person assistants, but right now we are allowed to do the phone application. But we also have all but one of our sites open. So throughout Schenectady, Albany, and Rensselaer County, we have currently 6 sites open that we can meet face-to-face with individuals to do the application assistance. And that is in a nutshell, a little quick. I know I talk fast, so I apologize. Does anybody have any questions?
If you have any questions, you can feel free to put them in the chat at any point throughout the presentations. Oh, somebody said they do have a question, I think.
Oh, Shelby, I actually, those questions that came in earlier that I was going to talk to, do you want me to do that now too?
Sure. Yeah, you can do it now. Or...
So, let's see.
Eliza, your question about if someone is 66 and needs health insurance, I think we're going to get to that in a little bit later in the presentation.
Right. So yeah, I'll touch quickly on that, is that anyone that's over the age of 66 has to apply through the Age Blind and Disabled program, and that goes through the Department of Social Services. Kathleen is going to speak to that program towards after Krista. But we had a question come in prior to the prior to the training that asked when it is appropriate to contact the marketplace or the county for Medicaid questions. So if it's case specific, then you would have to know whether the client has Medicaid through the Department of Social Services or whether they have Medicaid through the marketplace in order to get case specific questions asked. If you're not listed on the case, you're not going to get those questions. So if it was just general questions, you could reach out to either one, except if it's the age, blind, and disabled program, you always want to go through the county. So if they're over 66 or if they're on Medicare with Medicaid, then you would want to go through the county Department of Social Services. If you have access to e-PACES and you have a client that you're looking up, and in e-PACES, if it says H78 on it, then you know that client has Marketplace Medicaid, not Department of Social Services. So that, and then when all else fails, you can call HCDI. We have access to e-PACES. We can look the client up, and typically if it's not a specific case question, and it's just a general question about Medicaid, then there's plenty of us here that probably could answer that question for you. What was the next one? So the way the marketplace works for deadlines, someone asked what are the deadlines, the start dates, that type of thing. So if a client applies before the 15th of the month and they're approved for straight Medicaid, their straight Medicaid goes back to the first of the month that they apply in, regardless of the date. But if it's before the 15th of the month, their managed care plan would start the first of the following month. So an example is if they applied on September 14th, their straight Medicaid would go back to September 1st. And their managed care Medicaid would start on October 1st. If the application was done and approved after the 15th of the month, so they came in on September 16th, their Medicaid would still go back to the first of the month for straight Medicaid, and it would start November 1st for their managed care Medicaid. The application process through Department of Social Services is completely different than it is through the marketplace. And that typically, Kathleen will touch on that, but typically those applications have a 45-day determination that the Department of Social Services has to determine their Medicaid in. But she'll touch more on effective dates and stuff like that. I think I hit them all. Did you see one that I missed, Shelby, at all?
No. We did just get a question in the chat. Can you explain why there are two entities to apply, DSS and Marketplace? Why not all Marketplace?
Okay, so that gets a little tricky, but I'll do my best to describe it so that we can all understand it. It is that me? So one is called Magi-Medicaid and the other one is called Non-MAGI-Medicaid. Department of Social Services does Non-MAGI-Medicaid. And the income guide for the age, blind, and disabled individuals are completely different than those that apply through the marketplace. They're also held to resource tests where they can't have any more than a certain amount of resources on top of the income. And they still, the age, blind, and disabled population that applies through the Department of Social Services still does the old application and a supplemental A, and that's where MSP, Medicare Savings Program, goes through the Department of Social Services. So they still, the county still provides those services over the marketplace it's a different income guidelines and eligibility criteria for both population, for those populations. I hope that helps clear it up a little bit. When Kathleen explains the age blind and disabled program, that will help a little too. That has more detail of why they have to go through the Department of Social Services over the marketplace.
Okay, so we will move on then to Krista.
Can everybody hear me okay?
Yes.
Okay, perfect. So my name is Krista Harbach. I am the community health advocate here at Healthy Capital District Initiative, as well as the ICANN coordinator. And I'm going to be picking up kind of where Allie left off, talking about that transition piece of when you have Medicaid through New York State of Health and now you are becoming Medicare eligible. Just before I get started, I'm going over specifically, since this is a Medicaid presentation, I am going to be specifically talking about people who have Medicaid and are transitioning, not people who have essential plan, qualified health plan, or like employer coverage, because that process does look a little bit different. And I also want to note that because of COVID, this process has been looking a little bit different, but I want to go over typically what this is supposed to look like for people who are transitioning. We can go to the next slide. Okay. So there's two different ways that you become Medicare eligible. You can either become eligible due to disability, and that's when you're collecting Social Security disability for 2 years, and you'll automatically be enrolled into Medicare after the 2 years of collecting disability. And then the second reason is due to age. So when you turn 65, for most people that we're going to talk about for this population that's on Medicaid and transitioning, most of the time they're already collecting Social Security benefits, so they are automatically enrolled into Medicare. However, if you do have a client that is not collecting Social Security benefits, because we're seeing more and more people that are holding off collecting Social Security due to work, but again, this population is Medicaid transitioning, they have to actively enroll at the beginning of their initial enrollment period, which is 3 months before they turn 65, the month of, and the 3 months after they turn 65. So they have to enroll within that time frame. You can go to the next slide. Okay. So I'm going to be talking about the transition when you're collecting disability first. This looks different than people that are aging into Medicare. So I have these really nice charts that are going to be on the next slide, but I kind of want to just go over it first, and I'm going to show you these charts because I think that they are a good visual on what that process is supposed to look like. So when you are becoming Medicare eligible due to disability, the first thing that's going to happen is the client's going to get a notice from the marketplace saying they're disenrolled from their Medicaid managed care plan. This does not mean they're enrolled from Medicaid. They're still going to keep their straight Medicaid, their fee-for-service Medicaid, but they're going to be disenrolled from the Medicaid managed care plan. At the same time, they should be calling the marketplace asking for Medicare Part B reimbursements, and they'll also get notices about what's called low-income subsidy extra help, which is an assistance program for medications, which will trigger enrollment into a prescription drug plan. So because you're disenrolled from a Medicaid managed care plan in this circumstance, but not disenrolled from Medicaid, the Medicaid is actually going to continue because the marketplace is required to give you 12 months of continuous coverage from your Medicaid from when you last applied or recertified. Because they're required to give you the 12 months, it's going to look like this. So say we have a client who is Medicaid eligible in October. They last recertified for their Medicaid in May of this year. Their Medicaid is actually going to continue until May of next year, 2021, but they're still Medicare, but they still have the Medicare. So they'll have Medicare, they'll have their Medicaid continue until that following month when they're due to recertify. And then what's going to happen is the New York State of Health is going to transition their file over to the Department of Social Services. And at that point, they'll get a notice to apply for Medicare through, or Medicaid through the Department of Social Services. And they'll also want to get their Part B reimbursement done at that time as well. I'm not going to talk about that process because Kathleen's coming up next and she's going to talk about how to apply, what that paperwork looks like. But that's what happens when you're becoming eligible due to disability. And if you want to go to the next slide, this I literally keep on my desk for people that are coming in because it's very helpful visual. It's from Medicare Rights Center. So if you don't know who Medicare Rights Center is, they're based out of New York City and they cover all things Medicare. They have a great interactive site called Medicare Interactive where you can literally type in any question. It's very easy to read, easy to understand, and this is a nice chart that just goes over exactly what I said. So they start receiving Medicare after 24 months of Social Security disability payments. They'll get a notice from the marketplace showing that they're disenrolled from that Medicaid managed care plan, and at that time they'll be enrolled into Parts A and B, also enrolled into Part D because they're deemed extra help. They'll call the marketplace to ask for reimbursements for their Medicare Part B, and then once that 12 months of continuous coverage ends, then the case will be transitioned to the local Department of Social Services. They'll get a notice from Department of Social Services asking them to recertify, which will trigger that application. They'll reapply, and then they have 45 days to review and approve or deny the application. The next slide talks about eligibility due to age. So the biggest difference is you don't get that 12 months of continuous coverage when you're aging into Medicare. So you're going to get a notice saying that you're disenrolled from your Medicaid managed care plan, and then they're automatically going to transition that file over to Department of Social Services. You'll keep your Medicaid until you turn 65 or you get that eligibility determination from Medicaid, but they're going to send you that application in the mail to recertify/apply through the county, through the Department of Social Services. And then I have another chart on the next slide that does the same thing. So it's like that same process, but due to turning 65, so you can switch over there as well. So again, I like to keep these visuals on my desk because if I have somebody coming in and I don't really know like what is supposed to happen, and maybe they're getting all these notices because like I said, they're getting a notice for this, they're getting a notice for that. I mean, it's a lot all at once, plus like there's different plans you can enroll in and they're just getting so much paperwork at a time that honestly a lot of people just end up trashing a lot of it. This might help decipher what some of that information is and what's relevant, what you don't need to keep. So I like these charts for that reason. So that's the bulk of the transition process. Kathleen's going to talk more about how to apply through the Department of Social Services, but I just wanted to talk about some common questions that I get because I feel like the transition is very confusing. I mean, it took me a little while to even know exactly how that process works, but a couple of different questions that pop up. I get a lot of referrals about people asking to be enrolled into a managed care plan. Managed care plans are plans that you can enroll in through the New York State of Health. There is no managed care plan for Medicaid when you have Medicare, but there are different dual plan options or special needs plan options. These are the insurance companies in this area. I hope I have them all listed there. I don't really go into the special needs options or the dual plan options. I usually either refer out to the insurance company if they know what plan they want to go with, or like they can contact the different plans and get all the information and look them over, or contact like an independent agent or something like that. But those are plans that combine your Medicare and your Medicaid benefits. Sometimes it opens up like provider networks. Sometimes they give other perks and stuff like that. So that's the plans that they want to look into. They won't be eligible for like a Medicaid managed care plan. Another question I get a lot of is, do I need to keep drug coverage if my Medicaid covers my prescriptions? So when you transition over and you're now Medicare eligible, your Medicaid is no longer going to cover your prescriptions. Now you have to get a Medicare prescription drug plan. Because this population of people is automatically deemed extra help, which is again that assistance program with prescriptions, they're automatically going to be enrolled into a prescription drug plan. And no, they don't have coming up on the next question, no, they don't have to keep that prescription drug plan. If that doesn't cover some of their medications, it might not be the best plan for them, and in that case, they would want to look and see if there's another option out there that would cover those medications better. Just a couple other questions that I get. People ask that if they're on a Medicaid managed care plan, that they like their plan, they don't want to switch to Medicare, do they have to take Medicare? So this answer I put yes for, but it is kind of confusing because technically you don't have to take Medicare, but you should take Medicare because if you don't take it, there's no other options for you. You really can't go through the New York State of Health because they're going to deny you because you are Medicare eligible. So yes, you do have to take Medicare because you're going to be disenrolled from that plan eventually, and you're going to want to have health insurance options. A lot of people ask about Medicare Advantage plans, supplemental plans. Do I need to get these plans? Again, we're talking about people who have Medicaid and are being transitioned over to the Department of Social Services. For these people, no, they don't have to get a Medicare Advantage plan or a supplemental plan, but they can have access to them if they want. There's different programs that can help you enroll in these, such as HICAP or even my program, the Community Health Advocate Program. I help a lot of people with Medicare enrollment. And we can help out with comparing or even just inform the client on how to do this themselves if they would want to look into it themselves. 2 more questions, I promise. I'll go through these a little bit quicker. I have parts A, B, and D, but do I need part C? I don't know how many people I meet with that are like, I need A, B, C, and D, but you don't necessarily need part C. Part C is a Medicare Advantage plan. It is an option, but it's not necessary to have. And again, like a HICAP or insurance for somebody from an insurance company or myself can help you look through those options to help you make the best decision for you. And again, open enrollment is coming up for Medicare. It's October 15th to December 7th. This is the time that like all the plans are going to change. Clients should be getting like a notice saying what their plan changes are for next year. And this is the time to look to make sure all the drugs that the client is on is covered under the formulary, and if there's been any changes with their co-payments, co-insurance, so on and so forth. And because people who have Medicaid are enrolled into that extra help, it actually gives them some special enrollment periods throughout the year. So if your client is in the midway through the year stuck and maybe their plans, or they get put on a medication that their plan doesn't cover, they do have access to switch their plan throughout the year. So that's my little portion of the presentation. Again, Kathleen's going to come up and talk about exactly what that application process looks like through Department of Social Services. But does anybody have questions about the transition process? I know it's a little complicated.
We did receive one question. So when people are automatically notice that they're disenrolled from their Medicaid managed care plan, do they receive notice of how to apply to Medicare with that as well, or they just kind of have to figure that out?
So when they receive the notice saying they're going to be disenrolled from their Medicaid managed care plan, if they're becoming eligible due to disability, then they won't have to do anything because they're going to keep the straight Medicaid, the fee-for-service Medicaid, and they'll have Medicare, Medicaid, and they'll be auto-enrolled into a prescription drug plan. So they'll have coverage. From there, it's just if they want extra coverage, then it's looking into other coverage options. For that person, when they get the second notice, when their recertification period is, or when they last applied is, they'll get another notice stating that their actual Medicaid is going to end. That should trigger the New York State of Health to send over the file to the Department of Social Services. At that point, the Department of Social Services should send the client paperwork in the mail to fill out, and that's to apply through the Department of Social Services. So it's not going to have instructions of call this person to apply, do this to apply. They're going to actually send an application in the mail to the client to apply. And then that's the same thing for people who age into Medicare. That middle portion just won't happen. So when they become eligible, they're going to send over the file to the Department of Social Services. Department of Social Services will send out an application to the client to apply on that level. hopefully that answered the question.
We also got a question here, which Ali answered a little bit, but I'll let you elaborate on as well. Why would a 40-year-old client that collects disability be on Medicare? Should he not be on Medicaid?
Can you just repeat that one more time?
Yeah. Why would a 40-year-old client that collects disability be on Medicare? Should he not be on Medicaid?
So they might be on Medicaid as well, but the guidelines are if a person is collecting Social Security disability for 2 years, they're automatically going to be enrolled in Medicare. I mean, they might not be on Medicaid and automatically enrolled into Medicare. There are circumstances where people are maybe working part-time or, you know, have other insurance but are considered disabled, and they transition into Medicare because they've been collecting Social Security disability for 2 years. That's how the process is. So I know, unfortunately, some people don't want Medicare and are collecting disability, but that's how that process happens.
Does anyone else have any questions for Krista before we move on?
So one more thing before you transition it over to Kathleen, I just want to talk about COVID a little bit, just because I feel like that should be, you know, addressed. Because COVID, there are people's Medicaid are being extended through the New York State of Health that normally wouldn't get extended. It's very confusing process. So if you do have questions, because you have a client who is not following this chart, you have somebody come in and you're trying to help them figure out paperwork and they're saying that they're getting extended and it's just confusing, you can feel free to reach out to me or somebody at Healthy Capital District Initiative. We're more than happy to help look over whatever paperwork the client gets and try to help them decipher what's going on. I don't really have a great general answer for how this will look for everybody, just because it is not the norm and it's kind of a confusing process, but please feel free to reach out. That's what we're here for, to help.
Thank you, Krista. We'll move on to Kathleen.
Hi. So I am also going to talk about Medicaid. This is when somebody has Medicare and now wants to apply for Medicaid. It's not, you can just go to the next, what you do.
I wish. There we go.
Okay. This is when Medicare is primary and you're not going through the transition. This is when you want to apply for Medicaid. And this is what we were calling the age, blind, and disabled population. And if you go to the next screen, the aged is 65 years and older. Blind, of course, is certified disabled by the New York State Commission for the Blind. And then certified disabled could be one of two things. It usually is certified disabled by the Social Security Administration, but the state Medicaid disability review team can also determine someone to be disabled to receive Medicaid through DSS, and that's usually when they need to have home care services and they're over 65 and they want to, anyway, they can also be determined that way. And I'm going to talk about what's happening, what happens normally with the Medicaid application, and then I'll just mention what's going on with COVID too. So Ali talked a little bit about the MAGI population, which is modified adjusted gross income. And that is what is used to determine people's eligibility for Medicaid or any of the other plans through the marketplace. Medicaid through DSS is for the non-MAGI population. So there's a few different groups. People who should be automatically eligible for Medicaid through the local Department of Social Services, anyone who's on temporary assistance, receiving supplemental Social Security income, and people who have been in foster care up to age 26. Childless adults over age 65 who are receiving or are not receiving Medicare, because there are some people who are over 65 in our communities who are not eligible for Medicare based on their immigration or their work status. But because they are over 65 and they don't have children under the age of 18 in their home, they would have to apply through DSS regardless of what their income is. And then the childless adults under 65 who are receiving Medicare, and that the majority of those people would be your disabled people who are receiving Social Security disability income for 2 years and who automatically get enrolled in Medicare. The next group, they could be considered non-MAGI, considered MAGI or MAGI, and can apply under either process through the New York State of Health or DSS. And Ali mentioned this, if you have parents or caretakers who have Medicare, but they are caring for a child or grandchild or someone in their household who is under the age of 18, they can apply through either DSS or the New York State of Health. Again, people who are blind or disabled receiving Medicare, depending on their circumstances, can apply through DSS or the marketplace. People who are medically needy but have excess income or spend down, that big spend down word, they would apply through the DSS. And there's actually a question within the New York State of Health application that asks if you want to be considered for the excess income. And a lot of times that has to do with the services that they need. And then, which we're going to talk about, are people who are applying for non-MAGI services or programs. So that includes institutional care in a nursing home, and DSS calls that chronic care. Another MAGI program is the Medicaid buy-in program for working people with disabilities. Now, these people can have Medicare or not have Medicare. The income guidelines are much, much higher for people who are working and but are disabled and have SSD. The income guidelines and the resource guidelines are much higher as well for that group. There's a Medicaid excess resource program. So I'm just going to throw these numbers out, but we can give them to you again. An individual who is applying for Medicaid cannot have in resources more than $15,750. And that, we'll get into it more, but that includes bank accounts, IRAs, CDs, mutual funds, things like that. And there are programs where you can spend those resources down to be eligible for Medicaid. And then, of course, there's the excess income program, which is the spend down. And again, I'll throw this out. An individual who would like to be considered for Medicaid, their income has to be $875 or below. And there was a question about, yes, Tenley, I will. And then finally, and we'll talk more about spend down if you want, there's the Medicare Savings Program, which is a great, great program for people who are paying the Medicare premium, Part B premium, which this year is $144 and change. That program doesn't have a resource test. You can have higher levels of income than the $875, and I'll explain that to you as we go to the next slide. Maybe not the next slide, the next slide. So these are the Medicaid benefits under the different levels of Medicaid. So there's community-based without long-term care, and that's everything that you normally see under your regular Medicaid through New York State of Health. Inpatient, outpatient, doctor's visits, lab, x-rays, all those types of services. The next level is community-based coverage with long-term care. And as you see, there's a whole slew of services that would be covered under that level of Medicaid through DSS. Home care, assisted living if they are private duty, consumer directed, things like that. And then the final level, I guess, of programs would be the chronic care, which is the nursing home level of services, hospice in the home, and then manage long-term care in a nursing home. So those are the three basic lowdowns of what's covered under the Medicaid programs. And then there's MSP, the Medicare Savings Program. This is for individuals and couples. Most of all the programs cover the Part B premium if you're eligible. There's three different programs. There's the Qualified Medicaid Beneficiary. The income guideline is a little bit higher than the Medicaid. It's at 1041. And that would cover the Part A and B premiums, as well as the Medicaid coinsurance, deductible, and copays. So they wouldn't have necessarily full Medicaid coverage. They wouldn't have dental and vision, but they would have their deductibles and coinsurance covered through Medicaid when they see their providers. Then there's SLIMB, which is the specified low-income Medicaid beneficiary. That income level, again, is a little bit higher. It's at $1249. That will pay for the Medicare Part B premium. Now, someone can have that SLIMB and have Medicaid, but they would have a pretty good spend down, because again, we're looking at $1249. But again, it would pay that Part B premium. And if somebody needed home care, they might want to go for that spend down. And then the final one is a qualified individual, and that income guideline for an individual is $1406, and that only pays for the Part B premium. If someone is eligible for the QI or the qualified individual program, they have to choose whether they want that or they want Medicaid with a spend down. They can't have both. The Medicare deductible is considered a disregard, and they kind of discount it from or deduct it from the overall income of the household. That's one of the things that they disregard. So, but they would have to choose if they want that or they want Medicaid. So that's the Medicare Savings Program. So the application, there's two forms. There's the Access New York application, which talks all about your household and your household income. Who's in it? How much money do they earn? Where do you live? All that good stuff. Then there's a Supplement A that is all about your household resources. It's going to ask for bank accounts. It's going to ask for any CDs, IRAs, mutual funds, life insurance policies, burial plots, so much more. If you own your home, things like that. So they want to know all your resources. DSS does have an electronic method of verifying bank accounts and deeds for land. So they can use that. That takes about 10 days to do, but usually if you submit your most recent documents, that's acceptable for them. Allison did mention, oh, and then there's the Medicare Savings application. That's a quick one-pager. It asks about the household size and household income. And again, there is no resource test for that. So for the application, as Allie mentioned, through the New York State of Health, it can be determined right then and there within a very short time. DSS has 30 to 45 days to make a determination of coverage. Once they are determined, it usually will backdate to the first of the month that they sign the application and applied, even though it takes a couple months. However, if DSS requests additional documentation or information that isn't contained in the application, that could put off the start date, again, because it's going to take longer. Sometimes they go back to the original application date, sometimes they don't. It's all up to DSS. But we tell our clients definitely 30 to 45 days. And in a minute, I will talk about what's happening with COVID because it's completely different. The next page is just a few of the documents that they, DSS is gonna wanna look at. It's gonna be your proof of identity, proof of citizenship. If you are a US citizen, they can verify it through your social security number. Proof of residence to make sure you're living in the county that you're applying in. Current income, and that includes all income, social security, pensions, anything that you get on a regular basis. They wanna know if you're paying for your Medicare premium, if you're paying for any other health insurance premiums. Again, the resources I talked about were bank accounts, IRAs, mutual funds. We don't see a lot of that, but we do have people that we see people that have saved money their whole lives and have abundance of resources. And again, there's ways to get around that or pay that down, but that's one of the big things. You got to keep that $15,000 in mind. Part of spend down is past medical bills. So if people have past medical bills that they either want to have covered through Medicaid or put towards their spend down, they would want to submit those too. And as I mentioned, some of the other documents are life insurance, burial agreements, burial plots, taxes if you own your home, things like that. So if you go to the next one, facilitated enrollers are the folks that can do these applications for the Department of Social Services. We are certified through the state and trained through the state. We have relationships with the local Department of Social Services, and we're able to network with them and work with them to help that client get that application taken care of. But if you call us or any of the facilitated enrollers, we're going to do a quick intake to see how many people are in the house, income, resources, have an idea of what the application is going to look like. We can give them the income guidelines and they can determine if they want to go through with the application, regardless whether they're look to be eligible or not. We're going to do the application for them. We do the Access New York, the Supplement A, and the Medicare Savings Program if appropriate, and then we will deliver it to the Department of Social Services. We also sign those applications as the facilitated enroller, so they know that we can get correspondence from them, from DSS. And then just on the last page are our facilitated enrollers. The counties we serve are Albany, Schenectady, Saratoga, and Schoharie. And I'll put out there that the Independent Living Center of Hudson Valley does Rensselaer County. So that's all what's happening pre-COVID. Now with COVID, people who are on Medicaid through the Department of Social Services are also getting automatic renewals. If their recert comes up, they're getting renewed. I haven't seen one recently, but I haven't seen where they're not doing it. I think I've even seen September notices. In regard to the documentation, DSS is not really requiring any documentation up front. So we're doing the application with the folks over the phone and then submitting it on their behalf. If DSS wants documents, we will help them get them. But right now, our clients are just having to attest to their income and resources. I am going to answer a couple of the questions. I'll talk about spend down, which is the excess income. Again, the income guideline for Medicaid is $875. Anything over that would be considered spend down. You can do it in a couple different ways, 3 different ways actually. You can pay DSS right up front. I have some people that have less than a $10, less than a $20 spend down, and they write a check or send a payment to DSS on a monthly basis. You can submit paid or unpaid medical bills for your spend down. If you have accumulated bills that equal your spend down or come close to equaling your spend down, and if they are paid and within the last, I want to say 3 months, you can use those for the dates you're requesting Medicaid. If they are unpaid and you are still being billed for them, you can use those towards your spend down as well. You still have to pay the doctors, but it would go towards your spend down, and then your Medicaid would be turned on for any additional services for that month. Spend down is generally based on a monthly amount. However, if you are inpatient and you have a spend down, your spend down for inpatient hospitalization is 6 months, but then you are covered under your spend down for 6 months. That makes sense. There's a lot more to spend down, and I'd be happy to give you information on it, but that's basically the 3 ways of meeting your spend down. We also don't try to tell people what tell them what their spend down is going to be, but we give them the number 875, and they can figure out pretty much what it is from there. Somebody also had questioned spousal refusal, and that just means that the spouse of the person applying refuses to or decides that they are not going to, they don't want their income or resources to go towards their spouse's eligibility. And there's a form that can be filled out. DSS still requests that information. They will take it under consideration when determining the eligibility. From my understanding, if, however, there is ever a lien put on the client's property or whatever because for Medicaid payback, then the spouse's income and resources would be charged or put a lien against as well. But like I said, they can sign a form that says they don't want their resources or income applied to the person's eligibility, but they still would have to submit it. Don't know what's happening now during COVID, but that's how it generally works. I talked a little bit about how the eligibility works, but the third question was, when can they get benefits? Again, if everything goes through, DSS will backdate to the first of the month that you applied for Medicaid. If people want to tell their providers that they've applied for Medicaid and they're just waiting for their eligibility, that's up to them. But we tell people that Medicaid will backdate 3 months if we request it. But until you are officially approved for Medicaid, that's between you and your provider. But benefits would start once DSS sends the determination. I think that's all I have.
Great. We do have a few questions here, but before we go into the bigger question and answer portion of the event, I wanted to just quickly introduce our healthcare plan representatives as well. Stop sharing this now. Okay, so why don't we start with CDPHP? Aretha, are you here?
Yep, I'm here.
Okay, I will pull up your document here. Can everybody see that?
Yes.
But over to you, Aretha.
All right. Well, thank you, Shelby. So what Shelby is sharing, and I believe she'll share it all to you guys as well if you haven't it yet, but it's just basically a summary of the different resources and phone numbers that would be hopefully useful to you all in your line of work. My role at CDPHP is I'm a community wellness advocate, so I really deal with everything that comes after an individual has been enrolled in the plan. And so I really help out with linking and working directly with members to help them find medical providers that will be specific to primary care, dental care, behavioral health, help with scheduling appointments, transportation to and from those appointments, billing questions, new ID cards, really anything pertaining to the plan I help with directly. So the number that is provided on there is actually to my direct line. So you don't have to worry about calling member services, even though our member services is great. This is my direct number here. So I will be working with you or the member directly should they need any of these assistance, any of the what's listed below for assistance. In addition to that, we have for individuals that may have chronic conditions such as, high blood pressure, diabetes, or, anything that goes beyond, what we normally do as community health workers advocates. So anything that's really pertaining to that's clinical care or any clinical questions, you can still call me directly. Or you may choose to call our single source referral line that would get them connected to someone on our clinical care team that is a nurse and that would be able to help them with any of these conditions or anything that is clinical as well too. There really is no wrong door. So if you were to contact me for someone that is dealing with anything that is clinical, I can most certainly get you connected to this team as well too. If I didn't mention dental, we do have our own dental advocate, I guess we can call her. She's a dental specialist, and so her role really is to help out with dental care in general for both kids and adults. So if you were to contact me for someone that needs dental assistance, they will be working with her directly. So basically, she does what I do, just from a dental side. Really, the goal is try to provide personal care and assistance and really trying to mitigate a lot of the social determinants of health that someone may be dealing with as well. I believe those are the two main resources that we provide. So on this sheet here. So are there any questions or is there anything that I can clarify at all? Well,
I don't think so yet, but she'll still be here if you have any questions.
Yep.
All right. Jessica, did you want to introduce yourself?
Hello, everyone. I'm Jessica Thompson. I'm the Community Relations Specialist for Fidelis Care for the area. I am just going to give you all my direct line because I can get you all in contact with whoever needs to be in contact at the office. So my direct line is 518-229-7151. So if you guys need help with Medicare or managed long-term care or a case manager, anything like that, I can get you in contact with the correct person for the area.
Thank you. I'll include that number as well.
Okay, perfect.
With the resources that we share out. And lastly, MVP. Henley, did you want to introduce yourself?
Sure. Sorry, just took me a minute to unmute myself. I'm Tenley Klaus. I am the nurse manager at MVP Healthcare over our case management program, which includes all of Medicaid case management and our social work programs. We probably have about 30 different staff members on our team, and we deal primarily with Medicaid. But in addition to that, we also have a maternity program called Little Footprints as well. I also oversee health management, but health management is really all lines of business. So it's nice to see everyone.
See you too. Great. Thank you for being here.
Sure.
All right.
I also have two other members. I think Celeste had to drop off. Michelle, who is the director of our behavioral health program, and Sarah Savego, who is the supervisor of our Medicaid case management program. They're on the line as well.
Great. So now's the time to ask your questions. We obviously have a ton of panelists from different areas to answer all of your Medicaid related questions. I'm going to start going through and asking you guys the questions that I see in the chat, but feel free to keep plugging in questions and we'll just kind of see how many we can get through. So the first question, Kathleen, I think this one is going to be to you. you were mentioning the limits for Medicare, that 15,000 number. What does that number look like when someone is married, for a married couple? Is it the same or is it higher?
Shelby, there's two different limits that we were mentioning. We were mentioning resource limits and income guidelines to what they're eligible for. So I'm not sure. Was that Brandy? Were you looking for the income guidelines or the resource?
I have it.
I have it. I answered her. I just want to make sure I answered her the right thing.
Well, the resource is 23 for a couple and 15,750 for an adult or for a single. Is that what?
Brandy, were you looking for the income guidelines or were you looking for the resource guideline?
Income is 875 and 1284.
Yeah.
Okay, so that already was answered. Sorry about that. Shows how much I'm learning about Medicaid throughout this process. Okay, so we also got another question about what changes are happening with Medicaid on 10/1.
So you're talking about the long-term care, the new long-term care look-back period. So currently there is a 5-year look-back, 60-month look-back for clients who are people who are applying for nursing home Medicaid coverage for nursing home. There has only been up until October 1st. You only had to attest to your resources for community-based Medicaid, and you only had to provide a current statement of your resources for long-term care Medicaid. Starting October 1st, they are doing a 3-year or 2.5 year, right? 30-month look back for anyone applying for Medicaid with long-term care. And what they're looking for is for people moving resources, whether it be in or out, to become eligible for Medicaid. If someone, what I believe is, my understanding is if you are applying for long-term care and you do it, your application is signed before October 1st, they are not doing the look back. However, and again, I don't know what's happening with COVID, but on 10/1, when they get applications for long-term care, they're going to be doing a 30-month look back. And that would be the change that's happening on 10/1. Allie, anything else you can think of for that? No? Okay, good.
I think you got it.
The next question has to do with Medicaid eligibility. So when you're filling out an application in the marketplace and it asks for your income for the entire household, does this include roommates or like non-married couples? Would they have to include?
Good question. The marketplace Medicaid household income is defined by your tax filing status. So if you are, let me get this straight. So dependents that you claim on your taxes are also considered in the family size and their income is included. So anyone that's on your taxes and is earning income, you have to include them in your family size and you have to include their income. The flip side to that is to say you don't file taxes or mom and dad aren't married, so they don't file jointly. 2 parents living in the same home with a dependent, both their income is counted. If a sibling is working, they're 19, their income is counted in that household size and eligibility for the dependent child that's applying.
Yes, we will email this presentation out to you guys after, along with the resources that we're going to go over. So anyone have any other questions right now that they know off the top of their head?
I wanted to just clarifying the 30-month look back. I'm just still a little bit confused about that because I thought that the look back was primarily for the purposes of people sort of managing their money for long-term care, and at 5 years across the board, how is this, I guess, how is this 30-month thing different? And maybe I misunderstood that.
So the 30-month look back and the 60-month look back, what they're looking for is to see where you're moving your money.
Okay.
So that, say I have a ton of savings, but I know I'm going to need nursing home care, but I move money out of my account to reduce my resources. That's
Right.
what they're looking for, is that you're not moving money to a family member, someone else's account, withdrawing it for purposes other than your bills, your medical expenses, that type of thing, that you're just not. So that's when they're looking back, that's what they're looking at. If there's, for the 60 month, the look back is for any withdrawals, transfers, that type of thing of $2,000. I believe it's $10,000 for long-term care, correct, Kathleen?
Say that again?
The amount that you can transfer up to is higher for the long-term care. It's $10,000, wasn't it? More than 2,000. In 60 month look back, they look at anything over $2,000. But for the new 10-1 look back, I believe it's 10,000.
Oh, I don't remember that amount. I don't remember.
We can get that back to you. I can confirm that I'm right on that, and we'll send that out to you in an email.
Okay. I didn't realize that there was such specificity to all of that. I just thought that they looked at 5 years movement of any money, and
you have to, for the 5-year look back, anything over $2,000, you have to provide receipts or explanation as to where that money went, and that's money coming in or out. Because if you can't provide proof of that, whatever you're moving that for a legitimate reason, they can penalize you for a period of time, saying you're not going to have coverage for X amount of time, and then coverage, it's a penalty if you can't prove your transactions.
Very good. Thank you.
Mm-hmm. Shelby, can I talk about the trust?
Yes, go ahead.
So I kind of touched on this when we talked about disability. So yes, when somebody has excess income, we do talk to them about the trusts. We usually refer them right to NYSARC because we can give basic information about it. We know how it's set up. We kind of know how much it costs. We know how it works. We know the process. So it does protect their money, whether it be resources or income. So the trust, this type of trust was initially set up for parents of disabled children. So they could put money away for this child, so that child would be taken care of, that disabled child would be taken care of when the parents pass. Well, it has changed, so you kind of put money into this trust, let's say for yourself as an adult, to make you eligible for Medicaid. It protects your money. So it usually applies to people who are under 65 and disabled. And as long as you're SSD, it goes through. If you're over 65 and you want to do a NYSARC trust, DSS does their own disability review to make sure you would meet the disability requirements to have that trust offset the spend out amount. So it's a great trust. It does take a little bit of money to set it up, but you can, through the trust, you can pay your rent, you can pay your phone bill, you can pay credit card bills. There's so much that money can go towards, but not be in the client's pocket. That's the purpose of the trust. So that money isn't just readily available to the person. But it's still, they get to pay for many of the things. There's so many things that can be paid for out of that trust. The bad side of it is if that person passes, any money left in that trust goes back to the trust company or whatever. Does that help? And again, if you work with our facilitated enrollers, all that would be explained at the time of appointment. And actually, people come to us asking questions about trusts. So people are aware of it.
Shelby, can I speak for a second?
Of course.
Okay. So I just wanted to touch base on a couple of things that I might have missed. The renewals. So Medicaid, with COVID right now, all Medicaid recipients through the New York State of Health Marketplace are getting auto-renewed or extended. Typically, it started out at 4 months. Now, typically, they're extending people for 1 year. So that's just, and I know a lot of people hear a lot about open enrollment. And we're talking about Medicaid today, so it really doesn't apply to those individuals applying for Medicaid. Medicaid, you can enroll any day of the year. Child Health Plus and the Essential Plan, you can enroll any day of the year. Those people that are eligible for a quality health plan typically have open enrollment, but during COVID, as of right now, there is no open enrollment. They're allowing people to enroll at any time. Shelby's going to send out some handouts. One of them in there is the cheat sheet of when to apply where. And that again, I think that's really the key. Like we've talked about a lot of rules and a lot of exceptions and exclusions and when to do this and when to do that. And that's why there's certified application counselors, navigators, facilitated enrollers, marketplace representatives, health plan representatives, is so that they can do this for you and your client. So, I think that where to apply for health insurance is really a key for you guys. If you ever have any questions, Healthy Capital District Initiative, all the staff here that answers the phone can screen someone to see, oh, I don't know if this individual is supposed to go through DSS or through the marketplace. Whoever answers the phone here can figure that out for you. And then we let ABD know this is a referral for you. Navigator, we set up the application appointment for them. We can also have access to e-paces, so we can even look up someone to see if they do have Medicaid for you, those type of things. So, when all else fails, give us a call or refer to this cheat sheet, because we don't serve Montgomery or Fulton County or Saratoga for Navigator. We serve it for certain things, but this little cheat sheet will help you out a lot.
All right, we have a couple of questions here about college students. So I think it'll probably start with one of you guys and then maybe even go into the healthcare plans a little bit. So for college students, if you are out of the state and you wanted to apply for health insurance, what does that look like, firstly?
So where you apply for health insurance is based on your residency. And the college rule is if you go home on breaks during summer, the school breaks during the school year, and your residency is still at home here in New York, then that's where you would apply. If you get an apartment and you move your residency to Pennsylvania and you only come home on Christmas Eve to be at mom's on Christmas Day, you're not a resident of New York State. You would apply in Pennsylvania where your apartment is and where you're residing. But if you are on campus or you are just renting an apartment that you use only during school year and you come home on the breaks and your residency is still here in New York State, then you can apply here in New York State.
So let's say that somebody was from a different state and then they came to college here in New York State.
So that would work just the opposite. So if they still have residency in Pennsylvania and they're only coming to New York to go to school and they go home on breaks and they go home during the summer and that type of thing, then they would not be able to apply here in New York. They would have to apply in their home state. But if they can't move to your established residency by renting an apartment, buying a house, going to college here, and only going home just to visit, then that's where they would apply, is in New York State.
And then following up with that, this question specifically was addressed to CDPHP, though I think it might be the same for other plans as well. But if somebody applies for coverage, say here in the Capital Region, and they're a college student out in Rochester, they were saying that their client has trouble getting services out in Rochester because CDPHP is only in the Capital Region.
Correct. So we're not biased to health plans as navigators. So that is something a navigator or a CAC or anyone would educate them on. And when we're sitting with them doing the application, going over primary care engagement, that type of thing with them, we are going to ask them things like that. And we would help choose a plan that covers both areas for them, because you can't, if you're not a resident in Rochester, you can't put that. So the application automatically brings up the plans based on your residency. So here in Albany County, if you put that, you're going to get the plans that serve Albany County. So we do, we have a ton of college students that do this, but we also have people that see specialists in New York City, this and that, and we will go over the plan coverage areas for them, with them, to help decide which plan to pick.
Okay. Does anybody else have any questions?
There's a question here on the chat, but I think it says disenrollment letters from your state. So once they're disenrolled from, if New York State is sending them disenrollment letters, it should have their termination date, but it's typically the end of the month. Medicaid or managed care plans typically, I don't think I've ever seen them terminate someone's coverage in the middle of the month or a certain day, unless it's that they've moved out of state or or they've requested it. So typically the termination date for managed care plan or Medicaid is at the end of the month.
I want
to ask a question.
Yeah, absolutely.
Okay, sorry, Allison. So what it seems like is happening is that there are members who are in the marketplace currently. They received a letter for an extension because of COVID. And then out of the blue, people are just now starting to get letters stating that they're going to be disenrolled. And since they're being disenrolled, then they're going to obviously not qualify for Medicaid once they get in the marketplace. And I was under the impression, and I could be wrong, but that there was not supposed to be any, that the county should not be doing any determinations for Medicaid eligibility for anybody who's losing their coverage. Everyone's supposed to keep what they have. And that's what I thought was the case, but
yeah.
I don't know.
So you're talking about COVID. So we have had a lot of, discrepancies. I think the system gets some glitches, like they got extended, next thing you know, they're getting the disenrollment letter, or they got disenrolled and they didn't get extended, that type of thing. So Krista, who spoke earlier about the Medicaid to Medicare transition, she's a community health advocate. She can also help tackle these obstacles to care, obstacles to coverage. Sometimes it does come down to us as navigators, where we have a contract manager through the New York State Department of Health, and we can submit what they consider a problem case summary to them and get them to look at the coverage, the eligibility, see why the client was dropped, that type of thing. The other piece is that I didn't mention this earlier, and I probably should have. Typically, once you're enrolled in Medicaid and you're in a guaranteed coverage period, you're in that coverage period for 12 months, regardless of change of income. So as navigators, or even as Krista, as a community health advocate, we would look at all that based in the case and say, okay, well, when did they get coverage? When should their guaranteed coverage period went? Why were they disenrolled? We have a navigator line that's through the marketplace that we can call, and we get a representative on there, and as long as we're navigators on that application, we can get information of find out why as an oversight manager to the dashboards, I also can see all the notices that went out to any of my assisters' clients and stuff like that. So we try to tackle that problem for the client we act as the middleman between them and the marketplace. So you know, you can shoot me an email even and just say, you know, this is the client or this is the situation, and we can try to break it down for you.
Can I just add to that too? Hi, Brandy. Okay, so and Allie said this a little while ago, is that some people's Medicaid were extended 4 months, and then some people were extended a year. So I'm not quite sure of the circumstances of your clients, Brandy, that you're talking about, but it may be that they were extended 4 months and not a year, and that's why they're now getting that disenrollment letter as well.
Would there be a reason why people were extended 4 months or 12?
Yes, because the New York State Department of Health and the New York State of Health, when they first started the extensions in March, was when the first extensions went out. They said, we're only going to do this for 4 months, because seriously, who thought this was going to last forever? But so that's one thing. But the other part of that is that they changed it to the 12-month, because what was happening was, so if you were extended in March, in July or June, you had to do your thing. Well, so did the June people. They had to be extended or renewed at the same time as all the March people, and New York State, the marketplace couldn't keep up with that. So instead, they realized this isn't going to work if we have all of March's people and all of June's people renewing at the same time. So they switched everybody and put them on the same month that they were due to renew, and extended it a whole year, so that we didn't have clients overlapping from month to month. It just took them a little while to catch on to it, type thing. So, but they were going back at one point and doing, like, April was going back to 12 months eventually when they got to the end of that 4-month period. So, but there were people that fell in the gaps. So if you have some clients that fell in the gaps, let me know and we can help them out.
Okay, I'll reach out to you, because we have a nice chunk of people who have had this issue.
Okay.
So I want to quickly take you guys through the resources that we have together, just to show you how they work and what we put together. So let me just share my screen. Okay. So Allie mentioned this one, the where to apply for health insurance. So this is kind of your go-to guide of where to go if you have any questions. And as Allie mentioned, you guys can always reach out to us here at HCDI. Well, not me, but them. But you can reach out to me. I'll forward it to them, but not my area. Okay, this next sheet that we have here, this just tells you the different Medicaid managed care plans, and you click on them, it will bring you to their website, and it just tells you the counties that are covered and where you can get some enrollment assistance if needed. Oh, and this is also where you can get insurance assistance and all of the different services for each of the counties. And then here is a chart on the ABD program that Kathleen mentioned. So it just has an overview of the programs and descriptions for you guys. And then following along with that, this is where you can find the enrollment assistance for that program for each of the different counties. So it's either us at HCDI for Albany, Saratoga, Schenectady, SAIL for Fulton and Montgomery, and as I mentioned before, the Independent Living Center of Hudson Valley for Rensselaer counties. And then we have a Medicare 101 sheet for you guys. Just gives you an overview of the different parts and what the differences are. And then lastly, we have a document here where we just put the member services information for the different managed care plans, just so you can have everything like on one document of this is where we go to get vision providers for Fidelis, MVP, and United Healthcare, because those are 3 of the 4 managed care plans in the area. And then we have CDPHP made their own directory sheet for today, so we have that in here as well, as we mentioned. This is her direct line. And I will include Fidelis's contact information, Jessica's, in here as well. I'll email. So these are the resources that we put together for you guys. So does anybody have any more questions? Any difficult cases that you're working on, or anything else that you want to hear from any of our panelists or the managed care plans about?
While we're reading for questions, I just want to add one more thing because I saw a comment that made me think of it, and I just wanted to put it out there as well. During that transition process, if there's people that now have a spend down for their Medicaid, because like we talked about, that income guidelines do change, and maybe they can't afford their spend down to have the Medicaid, there are different Medicare plans available, and you just touched on like the Medicare Basics, which made me think of it as well. Open enrollment is coming up, so for those people who maybe don't want to do the spend down and want to look at other options, such as like a Medicare Advantage plan, or what original Medicare looks like, or what like a Medigap supplemental plan looks like, there are different programs available. I help with that a lot, with understanding Medicare benefits. You can contact plans directly, or there's the High Cap program that helps with Medicare and understanding Medicare as well. So just to put that out there, so that way you guys know if you have a client who says that in order to keep their Medicaid it's just way too expensive, there are other options out there depending on like what they're using their insurance for.
We did get a question here saying we frequently work with patients who are moving from New York City to other upstate counties and need to change their Medicaid. Any tricks on how best to do that?
Are we talking about New York State of Health or DSS?
Both.
Marketplaces, you go back into the application and change your address. DSS, you have to have your case transferred from one county to another, basically.
Yeah, the marketplace, they can update it on the address, or they can call New York State Medicaid Choice.
Yep.
And change their address and get their managed care plan changed if need be to one up here.
But if they have DSS Medicaid, right, they have to change the county of their Medicaid.
Right. They have to notify the county that they're living in, that they're leaving, and that county holds them on for 30 days. And then they will be terminated from the county that they're leaving, and then they have to apply in the county that they're living in. For the marketplace, they can just call the marketplace, or they can call New York Medicaid Choice and get their information updated, or have a navigator do it for them on the application.
Just while we give everybody a couple more minutes to think of any questions, I'm going to screen it again. Just want to quickly point out that we updated our Determinants of Health Resource Guide. For those of you who aren't familiar with it, basically it is a guide of referral resources by category. So you can look here and see what services are available for food, housing, etc. We have the SDOH screening tool if you'd like to use that as well with your organization. Once you scroll into the food, for example, we have broken down by emergency food, nutrition supplement, things like that. And we tell you what county the services are available, what you need for eligibility, that sort of thing. So it's kind of a nice go-to guide of services in the area. We just got a bunch printed, so if you would like a copy, please reach out to me and let me know. We can get you copies for your organization printed. They are free. We are allowing up to 10 at the moment per organization, and it's also available online at any point if you're interested. And are there any last minute questions here? Great, Tenley, I will get those sent out to you. Great. Well, if there aren't any other questions, I won't hold this on until the end anyway. So I want to thank everybody for coming. And as mentioned before, please feel free to reach out to us with any questions. Krista and Allie and Kathleen put their contact information in the chat. I'm also going to include it in the follow-up email. I will give you the PowerPoint, the link to this video, some resources, as well as our contact information. So please feel free to reach out if there's anything we can do. And as I mentioned, in terms of this care coordination task force, if you have a topic that you would like training on, please feel free to reach out as well. I can try to arrange that. And lastly, I will mention that we do have our event coming up next month. Originally, we were trying to put long-term care services and waivers and all of that into one presentation. And we were like, that is going to be really messy. So we broke it up. And next month, we're going to be talking about long-term care services and advocacy. So we're going to go into some of that stuff, ICANN and all of that. That will be October 28th from 2 to 3:30. I will also send you the link to register for that as well. And we have that. Oh, and the last thing I promise is we are looking at changing our structure of this task force a little bit, thinking that we may switch over to more of a steering committee, just so that way we can get more trainings and more content out to you guys, because that seems to be what most people prefer, rather than rather than our every other month meeting. So if you are interested in joining our steering committee that we are going to have starting up in a little bit, please let me know. We could use your help and ideas for trainings and how we can better support the care coordination workforce in the capital region. So with all that being said, I will, if no one has any more questions. Thank you, Allie, Kathleen, and Krista, and thank you to CVTHP, MVP, and Fidelis for all being here, even though no one had any direct questions for you. We appreciate you being here.
Thank you.
Thank you, everyone.